Welcome. In this video, we'll explore traumatic brain injury or TBI, a complex and potentially devastating condition affecting millions worldwide. We'll delve into what TBI is, its causes, how it impacts the brain, and the steps we can take towards prevention and recovery. So, what causes a TBI? Essentially, it's an injury to the brain resulting from an external force. This force can be a blow or jolt to the head, or a penetrating head injury. Common causes include falls, especially among young children and older adults. Motor vehicle accidents are another major culprit. Assaults, sports injuries, and even explosions during military combat are also significant causes of TBI. To understand TBI, we need to talk about what happens inside the skull. The force of the impact can cause the brain to bounce around, twist, or even stretch inside the skull. This movement can tear blood vessels, damage nerve fibers, and cause bruising and swelling of the brain tissue. This primary injury triggers a cascade of secondary events, including inflammation, altered blood flow, and the release of toxic chemicals, all of which further contribute to brain damage. This complex process disrupts normal brain function, leading to a wide range of neurological deficits. TBI is a significant public health concern. Estimates suggest that millions of people experience a TBI each year. While anyone can sustain a TBI, certain populations are at higher risk. These include young children, adolescents, older adults, military personnel, and individuals involved in contact sports. Understanding the epidemiology of TBI helps us to focus prevention efforts on those most vulnerable. The signs and symptoms of TBI can vary greatly depending on the severity and location of the injury. Mild TBI, often referred to as concussion, may involve headache, dizziness, confusion, memory problems, and changes in mood. More severe TBI can lead to loss of consciousness, seizures, weakness or numbness, difficulty speaking, and even coma. These symptoms can emerge immediately after the injury or may develop over time. It's important to seek medical attention promptly if you suspect a TBI. Diagnosing TBI involves a comprehensive evaluation. A medical professional will assess the individual's level of consciousness, neurological function, and conduct a thorough physical examination. Imaging techniques such as CT scans and MRI scans are often used to visualize the brain and identify any structural damage, like bleeding, swelling, or skull fractures. Neuropsychological testing can also be helpful in assessing cognitive function and identifying specific areas of impairment. TBIs are often classified based on severity, using scales like the Glasgow Coma Scale (GCC). Mild TB, mentioned, is often synonymous with concussion. Moderate TBI involves a longer period of unconsciousness or confusion. Severe TBI typically involves prolonged coma and significant neurological deficits. Another way to classify TBIs is by the type of injury. These include closed head injuries, where the skull remains intact, and penetrating head injuries, where an object pierces the skull and enters the brain. Diffuse axonal injury, a widespread injury to nerve fibers, is another significant type of TBI that contributes to long-term disability. Treatment for TBI varies depending on the severity of the injury. Mild TBI typically involves rest, symptom management, and gradual return to activity. Moderate to severe TBI often requires hospitalization and intensive care. This may involve measures to control swelling, prevent complications, and support vital functions. Rehabilitation plays a crucial role in recovery, helping individuals regain lost skills and adapt to any remaining impairments. Therapies may include physical therapy, occupational therapy, speech therapy, and cognitive rehabilitation. Prevention is key to reducing the incidence of TBI. This includes wearing helmets when biking, skateboarding, or playing contact sports. Buckling up in cars is essential. Making homes safer for young children and older adults can prevent falls. Addressing issues like substance abuse and violence can also significantly reduce the risk of TBI. Public awareness campaigns play a vital role in educating people about the importance of these preventive measures. The prognosis for TBI varies greatly depending on the severity of the injury, the individual's age and overall health, and the availability of appropriate treatment and rehabilitation. Some individuals make a full recovery, while others experience long-term physical, cognitive, and emotional challenges. Research is ongoing to develop new and improved treatments for TBI. This includes exploring the potential of neuroprotective agents, stem cell therapy, and advanced rehabilitation techniques to promote brain recovery and improve outcomes. Researchers are also investigating biomarkers that can help predict prognosis and guide treatment decisions. Continuous research efforts offer hope for improving the lives of individuals affected by TBI.